Are you struggling with sharp shooting pain down your leg and wondering if it's ever going to ease on its own? Welcome to goPhysio Talks. We're here to help you feel great, move better and add life to your years. I'm Fiona and today we're talking about sciatica, what it is, what's really causing it and simple things you can do to stop it taking over your life. I'm joined by Paul, our co-founder here at goPhysio, our clinical director and a physio since 1997. So he brings years of real world insight into this conversation. So let's get into it. So Paul, what might think that you have sciatica?
Well, the true definition of sciatica, it's obviously referred nerve pain, which is radicular pain. So, you know, it would be more sharp, shooting. You would have to have pins and needles, and it would tend to travel from, you know, the spine all the way down the leg. So the worse the problem centrally in the spine, the further down the leg it refers, versus you know, normal referral pain from, let's say, the joints or the muscles. That tends to be a lot more diffuse, vague, hard to pinpoint. Sciatica would classically, you know, feel like you describe it as, you know, in a very specific referral pattern.
Okay.
Yeah.
And then what exactly is going on if someone has got sciatica? When they come and see you, what do you find is going on with them?
Yeah, there can be many causes. So when we first see them, obviously we need to get a full detailed history about, you know, the onset, if there was an injury or more of a gradual onset, and then obviously, you know, the types of patterns, what aggravates, what eases, and that can help us hone in on what structures it may be. So it could be, you know, the classic would be a prolapsed disc where you have a bulge, things like bending, flexion activities, sitting will increase the bulge size, pressing on the nerve and referring down the leg, and things like standing, walking, taking the pressure off the bulge would ease the sciatic pain. So yeah, that's what we're trying to do. We're looking at, you know, the anatomical source of the pain, the mechanism, and then from that, you know, we can work out how best to treat it. And it's all about stop making it worse. So we're educating the patients, you know, how to avoid those positions that increase the bulge and the sciatica, and then how to start making it better. So get into positions that take the pressure off, and we find once they're doing that and we train them how to get better, that's critical. A lot of sciatica, both acute and chronic long term, is behavioral. So once we train them how to stop making it worse, how to start making it better, it just amplifies the success of our treatment in clinic.
Great. So as a physio, when you see someone come in with sciatica, so what treatments might you do, or what might treatment look like for someone who is coming to you with sciatica?
Yeah, so in the assessment, you know, while I'm assessing, I'm working out how to treat them, you know, that's the whole point. So rather than movements that aggravate pain, we're looking at movements, positions that ease pain, and then that filters directly into, you know, the home exercises you give them. So it's all pain relieving. With sciatica, you know, assessing, treating, you know, it's not like no pain, no gain. It's the opposite. You want to be just switching it off, because if you're aggravating it, you're just increasing the pressure on the nerve, increasing the swelling, which lead to scarring, neural adhesions, and that's where it becomes chronic, because patients haven't really been taught the correct approach for, you know, treatment. So yeah, the types of things. Classically, yeah, I would be putting them in positions that switch off the leg pain. That's primarily what I'm looking for in that assessment. And you know, someone could come in with, you know, pain all the way into the foot. It's been constant, it's been worsening. It could be like an 8 out of 10, quite severe. And yeah, in that first session, sometimes, you know, we get it to a 0. So then it's educating them how to keep it at a 0. Don't get me wrong, everyone, you know, no one's perfect. Can bend and twist and tweak it, but then they're prepped with how to switch it off again. So classically would be things like a modified Fowler's positions, we'd be doing manual traction, we'd be doing even mechanical traction has its place. But conversely, if it's more of a stenotic picture, i.e. degeneration, you know, in the canal where the nerves exit the spine, we'd find it's the opposite that would relieve it. So bending would ease it, anything that gaps that space and reduces the compression. So there would be things like prayer stretch, yeah? So end range flexion, posterior pelvic tilt. It would be, you know, activities, if they're out for a walk, yeah, to sort of posterior tilt and take the pressure off, because it tends to be standing and compression positions and movements that aggravate those cases. So yeah, it's all about identifying the pattern, and then yeah, you know, the treatment can be straightforward.
So what I'm hearing from what you're saying, Paul, is that there isn't a one-size-fits-all treatment for sciatica.
Not at all.
It's very focused on identifying what exactly the cause is and making sure that that's addressed. Is that right?
Yeah, it's key, because even with, you know, the same cause of sciatica, two patients of the same cause, and seems similar in site and spread and severity and agonies, there can be so many unique variables to that case, and they all have, every patient is different, it's commonalities, but you know, they all have their unique characteristics that, you know, need to be assessed fully to, and the devil is in the detail with sciatica, without doubt. Yeah, so you need to really get in front of the right person who can actually, you know, identify and help you take control, basically.
Okay. And are there any sort of common myths or any misunderstandings that are associated with sciatica?
Any myths around sciatica? Yeah, I'm sure there's quite a lot. I think the name itself, sciatica, if you look into it, yeah, it's not truly, you know, sciatica. Yes, it's the sciatic nerve in pure sciatica, but you know, people use it, you know, to label a lot of referred pain. Yeah, so the true term is radicular pain. Yeah, pain from the nerve system. Other myths, well, it classically gets misdiagnosed a lot. You have cases where patients have, you know, spinal surgery on the incorrect anatomical structure with no change in symptoms.
Wow.
So yeah, and that's, you know, the specialists. But from a patient perspective, the myths would be that it's something that happens to you, you know, you're a victim of sciatica, which is definitely not the case. Again, it's understanding all the behavioural aspects to it, you know, your day-to-day life, what positions are aggravating it, because often with sciatica there's a latency, period of delay, because it's neural, and that adds an extra layer of confusion. So you know, you may be doing an activity that aggravates it, but you haven't quite really noticed, and then, you know, 10-20 minutes later it's flared up. So yeah, we help patients see the wood from the trees and really, you know, focusing on those key bits. So you're not a victim. There's plenty you can do to take control and help yourself. And yeah, you know, you're not stuck with it. Treatment helps a lot. In some cases, it might plateau because of, you know, the severity of the injury. But yeah, you know, a good clinician will get you to the point you're happy with, and if not, refer you on to someone who can.
Excellent. So if there's anyone watching here today who thinks they might have sciatica, if there was one tip or any bits of advice you could give for them to go away with, what would that be?
Just next time you have it, monitor what you're doing or what you've just done, and that will give the clues into the sort of activities you you know, need to take care of and learn about, and often it's the opposite spinal posture position activity that will potentially give you some relief, simply put. And if you want to learn more, you know, 27 plus years of helping people, yeah, I'd be happy to have a look and see.
Fabulous, thank you, Paul. So, if sciatica's been getting in the way of your everyday life, whether it's sitting, sleeping, or just going for a walk, don't wait for it to fix itself. The right support and treatment, as you've heard from Paul, can really make a huge difference, and you don't have to figure it out alone. So, if you've got any questions, do feel free to drop them in the comments below, or book an appointment with one of our expert physios today. And don't forget to subscribe to goPhysio Talks for more practical advice, real life solutions, and remember, we're here to help you move better, feel great, and add life to your years. Thanks very much, Paul.
Thank you.